Did you know that between 20 to 60% of dentists will experience fraud at some point in their careers? That's according to the Colorado Dental Association. That means there's a high chance that you or someone you know in the dental industry has already dealt with fraudulent billing, whether intentional or accidental, and the consequences can be devastating. Legal fees, lost revenue, revoked licenses, and even the loss of your practice. It's Andrew from DCS, and in this video, we're giving you the ultimate guide to spotting and preventing dental insurance billing fraud in your practice. Stick around because this video could save your dental business. And as always, there's a link in the description to book a free 30-minute consultation with DCS so you can safeguard your practice and stop fraud in its tracks. Let's start with the basics. What is dental insurance fraud? Dental insurance fraud happens when false or misleading information is submitted to an insurer to receive unauthorized benefits. And here's the thing, even innocent mistakes can be considered fraud in the eyes of the insurance companies. Common mistakes that can get flagged as fraud include listing the wrong treating dentist, failing to disclose accident-related treatment, and using incorrect billing codes. Even if these mistakes weren't intentional, insurance companies won't see it that way. And that's where the trouble starts. So let's get into how fraud happens in dental and oral surgery practices. There's upcoding. This happens when a provider bills for a more expensive service than what was actually performed. Sometimes it's an honest mistake, but insurers may not see it that way. And there's unbundling procedures, separating services that should be billed together to maximize reimbursement. Fraud can also happen by billing for services not rendered. Yes, this actually happens, charging for procedures that were never performed. Misrepresenting procedures, changing the details of a treatment to get better coverage, and recording the wrong treating dentist, a mistake that can happen when an associate isn't credentialed yet. Angela Mormon-Rakestraw, our oral surgery business unit manager at DCS, has seen this firsthand.
So the most typical type of fraud that we see in oral surgery is when providers are contracted with a specific insurance company and they do not bill the claims out. So they may be contracted with Delta Dental, for example, and in network with that particular insurance plan. But if they're not filing all of the services on the claim, they are in breach of their contract.
The bottom line, most fraud starts as a small mistake, but it can snowball into something that puts your business at serious risk. So, how do you spot fraud before it becomes a problem? Look out for these 5 red flags. Number 1, unusual billing patterns and discrepancies. Number 2, staff members overriding billing software alerts. Number 3, patients questioning claims they didn't authorize. Number 4, high employee turnover in billing roles. And number 5, external audits uncovering suspicious patterns. If any of these sound familiar, it's time to take a closer look at your billing processes because fraud can happen right under your nose. What are the consequences of dental insurance fraud? According to the American Dental Association, or ADA, a violation can result in fines of up to $25,000 per claim submitted, imprisonment for up to 5 years, exclusion from federal healthcare programs. But that's not all. You could lose your license, your practice, and your reputation. Angela from DCS says this.
I've seen insurance companies red flagging providers and keeping them under a review process for up to 12 months or even 24 months just because of following improper billing guidelines with those codes.
And don't forget about your team and your patients. If your practice shuts down due to fraud, your employees lose their jobs and your patients lose a trusted provider. No one wins. The good news, fraud is preventable. Here are 5 ways to protect your dental business. Number 1, implement clear billing protocols and staff training. Make sure everyone on your team knows the correct procedures. Number 2, invest in your team's dental insurance billing knowledge. Mistakes happen when staff aren't trained properly. Number 3, set up checks and balances with segregation of duties. No single employee should control the entire billing process. Number 4, create a fraud reporting policy for employees. Encourage whistleblowing to prevent internal fraud. And number 5, outsource insurance billing experts. Having a professional team like DCS on your side provides an extra layer of protection. Angela from DCS says it best.
Make sure those employees that you hire, or those companies, revenue cycle management companies that you hire to bill out your insurance, they have the knowledge of all of the updated codes, all of the updated billing guidelines. Make sure that they're following those as well. That is the key to getting that claim out clean, getting it paid clean. It lessens the chance of a recoupment from the insurance company.
So now that you know the warning signs and the steps to prevent fraud, it's time to take action. Download DCS's guide to spotting fraud at your dental business. It's a quick and easy checklist that can help you catch fraud before it costs you thousands. Link in the description. And if you're ready to protect your livelihood, book a free 30-minute consultation with DCS. We'll show you exactly how to safeguard your practice and stop fraud in its tracks. That link is also in the description below. Thanks for watching, and as always, hit that like button and subscribe if you're new so you don't miss out on any new videos.